for us to really galvanise and deliver meaningful change, it has to include everyone. It has to amplify the voice of everybody, and they need to be at that table. And it also requires us as leaders to deal with and adapt to living with uncertainty, something that we have to develop as a skill. And I've worked really hard at it, and sometimes it's really challenging. But it's really important that we recognise that people are dealing with working in unprecedented and difficult and challenging circumstances. That requires us, everybody as humans, to be compassionate and kind to each other, but also to recognise that we are all dealing with different emotions, and this needs time and space for us to think about and deal with. And that's something I never really made the time to do before COVID, but I do it now. I listen more. I give time and space for emotion, my own as well as others, because actually it's important for us to listen, because if we don't, how will we learn and improve? And I don't have all the answers. No one does. We can't solve this in isolation, and what I've learned is actually having that time out, getting people together, really thinking about how we resolve and develop solutions as groups of people is so powerful. And I learnt this with the Bain Network. I've learnt this working in the distributed leadership model in the West Yorkshire and Harrogate Health and Care Partnership. Empowering others to lead can lead to some of the most transformational changes that can deliver improved care. Because at the end of the day, we're all here because we want to make people's lives better. But why don't we empower people to develop the solutions with us? Why do we feel that we need to develop the solutions and give it to them? Actually, doing this differently is empowering, not just for us, but for them.